Orla. Excuse me. Taoiseach, I wish to question you on the lack of any meaningful health reform in our health service. The consequences of not changing our model of care are very plain to see. Fine Gael has been in power now for 8 years and this government in power for the last 3 years. And in those last 3 years, we have seen little or no health reform. In fact, the situation has deteriorated. You talk about health reform, but you fail to implement what is glaringly obvious. Time is not on our favour as demand for our health service continues to grow with our ageing population. Sláintecare is now 2 years old, Taoiseach, but still awaits transitional funding to trigger meaningful rollout and delivery of better care to our patients. Sláintecare is stranded in the doldrums of inertia. There is much talk about implementation, but no implementation. Taoiseach, we can't reform the health service from current spending. It's not possible. Specific, independent, targeted funding is needed. Without this, Sláintecare would be just another report. Transitional funding is needed to shift the balance of care towards community care, while at the same time delivering on unmet need. New models of data gathering, digital healthcare records and individual patient identifiers are absolutely essential so that we can gather data which will make meaningful progress in informing how we reform our health service. The HSE service plan for 2019 clearly indicates that it will struggle to maintain services at 2018 levels, which were in themselves quite inadequate, and will not deliver services as we required them in 2019. We still do not have multi-annual budgets. Without this, long-term planning is impossible. Taoiseach, unmet need will continue to grow as elective care will be limited by necessity for providing only essential and urgent care in our hospitals. The expected increase in emergency admissions this year will diminish the ability to provide elective care. Taoiseach, meeting both the current and future challenges within our service as it is currently designed is not sustainable. The service is facing extraordinary challenges and will need an extraordinary response. The capacity of our service is at the maximum, even with ever-increasing unmet need. Our hospitals are operating at 100% capacity, which internationally is recognised as unsafe. We have a shortage of ICU beds, which limits elective care. We need 8,000 extra beds over the next 10 years unless we engage in extraordinary health reform. Opening 200 beds this year is wholly inadequate. We educate our graduates, Taoiseach, for export, our nurses, our doctors, our consultants and our GPs. This feeds into inadequate quality in the services that we provide. So, Taoiseach, the effects on this and on our population is quite clear. We have 100,000 people on trolleys, 70,000 people waiting elective care, 500,000 people on waiting lists. So my question to you, Taoiseach, is this going to be the legacy that your government leaves behind? And when are you going to deliver an extraordinary response that is needed to reform our health service?
I absolutely agree with you on one point, that we need more health reform. I don't agree with your contention that health reform isn't happening at all. And just let me give you a few examples in response to some of the questions that you raised. At Sláintecare, at the heart of Sláintecare, is the view that healthcare should be affordable and that we should extend free GP care to more people and reduce the cost of accessing medicines. That is happening. We've extended free GP care to all under 6s, all over 70s, an extra 100,000 people based on income from April. And in addition to that, we're reducing prescription charges, and we'll reduce them again in the next couple of weeks. Sláintecare, which I know you advocate, and I know you're a big supporter of Sláintecare, recommends that we extend free GP care to an extra 500,000 people a year. 500,000 this year, 1 million next year, 1.5 million the year after. I think you're mistaken in that. I think that's too fast. I don't think the capacity in our GP surgeries exists to increase free GP care as quickly as you advocate, which is an extra 1 million in 2 years, an extra 4 million, an extra 2 million in 4 years. I think that's too fast. I think you're mistaken on that, Deputy. But I know you're a strong advocate of the Sláintecare report. We're also investing in primary care centres, now 120 primary care centres open around the country. There were only 40 a few years ago. We've set aside a 10-year capital budget. That's a multi-annual budget if ever there was one. A 10-year capital budget, an envelope for health. of 11 billion, double what it was for the past 10 years. As a result of that, there are 4 new national hospitals under construction at the moment. 3 new national hospitals under construction at the moment, with 1 to go to tender quite soon. There is investment in ICT. The medlist system is now available almost across the board, so people can see blood results all over the place. We have it with PACS and what replaced PACS with radiology. We have it now with the maternal health record. Women attending our maternity hospitals having electronic records now, which they didn't have in the past. We're using reforms such as the commissioning model, using the NTPF to commission operations and procedures, and that's why the waiting times for people waiting more than three months for an operation or procedure has been falling now for months. And yes, we are increasing bed capacity by 200 last year, roughly another 200 this year. Was in Clonmel the other day, where there's a new 40-bed under construction. The Minister just gave approval for an extra 60 beds in Limerick the other day. And as a result of that, so far this year, the number of patients in trolleys, while still far too high, is at its lowest in 4 years, and let's hope that continues. And the next step, the next big step, and we're in negotiations with this, on this at the moment with the IMO, having concluded talks with the nurses on a new contract for them, is contractual reforms for GPs. We're very keen to get that done, to provide additional resources for general practice, but not just additional money for doing the same things, but change, embracing medicines management, embracing ICT, giving information that we need to plan our health services, and providing new services, particularly in the field of chronic care.
Note that you refer to your discipline and my discipline of general practice in relation to Sláinte care. And as you know, the continuation of FEMPI has devastated general practice. It will take years and years for general practice to recover from that. And you did refer to the expansion of primary care, and that is an essential component of Sláinte care. And you're quite right, you cannot expand eligibility and you cannot expand extra services unless you have the manpower to do so. And that is the very issue, Taoiseach. We do not have the manpower in general practice to underpin Sláinte care. We do not have the capacity in general practice to supply the increased eligibility that you propose to supply and to expand the range of services if GPs are not there. We are losing our GPs from our urban practices, not alone from our rural practices, and we cannot recruit GPs to supply the extra services. So you have put the cart before the horse, Taoiseach. If you're going to reform our health service, you have to expand manpower. You have to expand manpower in general practice, which is the underpinning of Sláinte care. Unless we have an expansion of primary care, Sláinte care cannot progress. And your government is damaging general practice by the continuation of FEMPI and failing to reverse it.
I followed with great interest the debate in recent days around how moving towards multi-annual budgets would help us to improve our health service. I'm broadly a supporter of multi-annual budgets, not just in the health service, but actually across the board. But before you can have multi-annual budgets, you have to demonstrate that you're able to keep within budgets and keep within annual budgets. We have a multi-annual budget in health already, a 10-year envelope for capital. Yet has the HSE and the health service managed to keep within its multi-annual capital budget? And is there anyone here in this House who genuinely believes that if we had multi-annual budgeting for the service side, for the current spending side, that the HSE, having gone over budget every year for any number of years, would not go over budget on its multi-annual budget too? And I believe they would. In fact, they may even burn up the money even quicker than they do now. We have to take those concerns into account. When it comes to GPs, we're training more GPs, as you know, have increased the number of training places, and thankfully those training places are being filled. We are in negotiations now with the IMO to restore funding for general practice, but also linking that towards important reforms, extending eligibility, moving into greater chronic care, medicines management and use of IT. And where I disagree with you in your strong advocacy for Sláinte care. Sláinte care is pretty unequivocal. They want an extra 1 million people by now already having free GP care, an extra 500,000 next year, an extra 500,000 after that. I think you're mistaken on that, Deputy. I think we need to do the other thing first.